The National Security Ministry has plans to establish a forensic mental health care program. So says Minister without portfolio in that ministry, Senator Matthew Samuda. He shared the details during his contribution to the 2021-2022 State of the Nation debate in the Senate on Friday. Minister without portfolio in the Ministry of National Security, Senator Matthew Samuda, says about 262 inmates have been diagnosed with mental disorders, 138 of which are unfit to plea, accounting for approximately 7% of the incarcerated population. However, this figure mostly represents those with psychotic disorders.
We know that a greater proportion suffer from less apparent psychiatric conditions that go undiagnosed. Global studies suggest that incarcerated people are 2 to 3 times more likely to have a mental disorder and 15 times more likely to have a psychotic disorder than the general public.
Minister Samuda notes that some of the challenges faced by the Department of Correctional Services are systematic.
Those deemed unfit to plea have been essentially held in custody indefinitely, as they are unable to undergo trial and complete the judicial process. The correctional system in Jamaica, however, is not presently suited to the proper care of mentally ill, as it has inadequacies in personnel, programs, and physical infrastructure to ensure adequate treatment of the medical conditions and the eventual assessment and reintegration of unfit to plea inmates and convicts into the society.
Minister Samuda says the DCS continues to work to improve the care within the system, and that's where forensic mental health care comes in.
DCS has been authorized to hire an additional consultant forensic psychiatrist who will design and oversee a forensic mental health care program, Mr. President. But beyond that, we have started the process of reversing a tragic mistake made in the 1970s when the then government closed a forensic ward that housed inmates in need of psychiatric care. And the truth is, both sides kicked the can down the road. Our ministry has initiated the planning process with the Ministry of Health and Wellness and the Ministry of Local Government, it should read rather, to reopen a proper forensic ward to be completed within this term of government.
He furthers that the DCS is following its legal and moral obligations to provide reports to the courts while taking steps to seek the release of the mentally ill where it is deemed appropriate.